Okay, so today our presentation is going to be over multicultural competency and truth telling. So I think first we should start off by defining what multicultural competency and truth telling is. Multicultural cultural competency is not necessarily needing to memorize every single culture in the world, but rather recognizing that there are different cultures other than yours and appreciating them and treating all cultural groups with respect. Truth telling, on the other hand, is a basic requirement of human interaction, and it's really just telling someone accurate information. Both of these are components that are important when it comes to making ethical decisions. Okay, so we have a video here, obviously from Grey's Anatomy. Okay, so why is this not? There we go. Okay, so for context in that video, obviously we know Dr. Bailey works at the Grey's Anatomy hospital, but in this video, she's not visiting her own hospital because she doesn't want her coworkers to know that she's having a heart attack. So she visits a nearby hospital instead, and she has work done to confirm her belief that she's having a heart attack. However, she experiences drawbacks from a white male doctor. This video demonstrates multicultural competence and truth telling because Dr. Bailey is a Black woman, as well as an experienced surgeon herself, yet she is having to push against the stereotypes that this doctor has created, stating that women too often are they over exaggerate and confuse stress with life threatening conditions, and they seek medical attention for no reason or to get out of work. In the end, Bailey does have a full heart attack, which could have been prevented had the doctor openly listened to her and her concerns, or had he told her the truth as to why he didn't want to treat her, and she could have gone somewhere else to get her treatment. So this is our first question. It just says, acting as the PT, which scenario accurately represents the best use of multicultural competency and truth telling regarding a PT patient with a different cultural background from you? The correct answer here would be A. Even though the patient's belief might be different from yours, it's still important to gather information about the patient and their beliefs and make sure the way you treat them is respectful and aligns with their views, because that is what helps build strong doctor-patient relationships. So, our thesis statement is that multicultural competency and truth telling are vital in creating equal and quality communication in any setting. Our four key points are listed here. The first one is respect. And what we mean by saying this is that all ethical decisions should be considering respect for diverse backgrounds, traditions, and perspectives. This means that when someone is talking to you about their culture, you are actively listening, avoiding stereotypes, and ensuring that the choices you make are not dismissive of certain cultures. Our second point is equity and inclusivity. What we mean by saying that is that ethical decisions need to promote fairness by recognizing that there are disparities in the system. You should be considering how policies and practices create one's um, background and make sure that all voices are heard and valued. Our third point is honesty and compassion. By saying this, we mean that, well, yes, the patient has the right to know everything that is going on with them. Um, they should be told that information mindfully as it could alter their life. You should be communicating accurate information while still maintaining respect for their values and their emotions. Lastly, our fourth point is transparency and communication. What we mean by saying this is that information should be told to the patient in a way that they can understand without leaving out any details. This is what helps build trust between the doctor and patient and can encourage the patient to receive treatment. So, this is our first discussion question. It just asks, how can different cultural beliefs impact the way truth is viewed and spoken in professional settings? To answer this, I would just say that it ultimately impacts how information is perceived and retained. Some cultures believe in full truth telling, while others don't think it's necessary because it helps avoid confrontation. If a doctor is treating a patient who feels strongly about truth telling and they withhold information from them, that might come across as like secretive or rude, which can lead to a mistrust between the doctor and the patient. On the other hand, if the doctor is someone who believes in truth telling, treats a patient who does not feel as strongly about truth telling, and they tell them every detail, they might come across as too blunt or like a know it all, which can lead to a sour relationship between the doctor and the patient. Overall, it's important for the patient to communicate their beliefs so that a doctor can be better informed and be cautious of how they treat the patient. Our first key point is respect. In the text, we read about Mr. King, who is a Chinese man living in the United States, visiting an American doctor named Dr. Rowan. Dr. Rowan examines Mr. King and determines that he has sciatica as a result from herniated disc that he will need to have corrected through surgery. Mr. King is convinced that he does not need surgery and that he will get acupuncture instead to treat it. As you recall, he wants acupuncture because he knows his insurance will cover it, but also acupuncture is a widely practiced medical treatment in China, and many people seek it in that form rather than surgery. However, Dr. Rowan is not considerate of this factor and describes that acupuncture is an ineffective treatment and does not order it for Mr. King. In this situation, I think there's a lack of respect on both sides. Mr. King is lacking respect for Dr. Rowan's experiences and beliefs and dismisses surgery as an option. On the other hand, Dr. Rowan dismisses Mr. King's experiences and beliefs by claiming that acupuncture is ineffective, even though it is what Mr. King wants. In situations like this, there has to be better communication between the doctor and the patient, describing each side's beliefs and why they believe their treatment recommendation might be in the best interests of the patient. Overall, both sides want what is best for the patient, but that cannot be done if cultural traditions, backgrounds, or experiences are dismissed. They need to be respected to ensure that the patient is getting what they want and need out of the treatment. Okay. And then this is another multiple choice question. It says, what approach is best for a healthcare provider treating a patient with beliefs that restrict certain treatment options? So the correct answer here would be C. It is important that all patients' wishes and cultural beliefs be respected and that treatment is specific to each patient.
Okay, our second key point is equity and inclusivity. And an example of this is the pelvic exam with the Muslim woman. Um, so a Muslim woman came into an outpatient clinic with 13 days of heavy menstrual bleeding and also pelvic pressure and pain. The doctor explained to the woman that she would need to have a pelvic exam, but she refused this exam. The doctor could have initially just accepted her refusal without asking her any more questions because she did refuse the treatment, but that wouldn't be the correct choice in this scenario, because he didn't understand her culture and like why she was making this choice, because because she because like he didn't understand her. She could have potentially not been treated, and then she could have like been harmed more in the future because of this. Um, he did ask her concerns about like why she didn't want to have the procedure and like her reservations on it, and they were that she couldn't be treated by a male because of I'm blanking on the word, but anyways, she needed a female doctor. And to and so because he now knows that she needs a female doctor in order to get this procedure, he can help her do that rather than just sending her home and being like, oh, you refuse treatment, so you're not gonna get this um help that you need. um so because he like asked her more questions rather than just dismissing her, that like helped her be like more included and ensured that she got the help that she needed. Okay. So true or false, the best solution when someone refuses a procedure is to immediately agree without further communication. So this is false. It's important to know why they're making the choice. You can help them make the right choice because you don't know like what's like impacting their choices and their decision process. And then question 5, this is a discussion question. So, what do you think the best way to address a case like the woman refusing the procedure? And is there anything you would do differently than the doctor did? So, my answer is that I think communication is the most important thing and making sure you're both understanding each other's perspectives. And I think the doctor did do a good job of that, but there's always like more, like, there was obviously a clear misunderstanding from the beginning that could have been prevented. Our next key point is honesty and compassion. And I used the example of Margaret and her treatment options. So Lorna is a physical therapist who had a patient, Margaret, who had a severe and rare bone disease. Lorna knew of a experimental program that could help Margaret, but her doctor didn't want to inform her of the choice because she thought that Margaret would get her hopes up for a better prognosis, which could not be the case. Lorna disagrees and thinks that Margaret should have all the information possible to make the choice for herself. She feels it's unethical to have this information that could potentially help the patient, but withhold it. The case This case shows that the compassion that Lorna has for her patients and her desire to be honest with them, that she has this passion. In most cases, this is the best option, to be clear and communicate these options, because although it may give Margaret a false hope, it also like should be a factor in her decision that she's making, and she needs to have that clearly communicated to her, and she needs to know all of her options and the risks and benefits with each of them. Um, so this question is, why is it important for healthcare providers to give patient all available treatment options? The correct answer is A, because the patient must make an informed decision about their care, and that's the top priority is them making their own choice. And then our last key point is transparency and communication. And I used the example of honesty after an error, which was more of like a broad topic, but I felt like it fit this idea. In the case of a medical error, it can be unclear what action should be taken. Some people like feel guilty and want to immediately tell the patient what happened, while others don't want to say anything and hope that the patient never notices that there was a mistake. Um, as we've already covered, clear communication is always like the top priority and is the correct solution when facing a problem like this. In most cases, the patient will be less likely to take legal action if there is transparency and communication about the incident right away, and that it's clear that the like person that made the mistake was cared about the patient and didn't intend harm or neglect. Okay, true or false? A healthcare provider should avoid discussing medical errors with patients to prevent causing unnecessary distress. This is false. False. The patient should still be informed of the error because they need to know what happened to them, and also they could potentially have more distress in the future if they were to find out this information indirectly.
Okay. And now we are going to go into our scenario. So the scenario says you are working at an occupational therapy office that sees mostly American patients on a day-to-day basis. However, today, a 67-year-old Japanese man, Mr. Soto, comes into your office seeking rehab for a stroke that he recently had suffered. Upon Mr. Soto's entrance into the clinic, it is clear that he is quite nervous and sorry, does not seem like he wants to be there. He also only speaks a few words of English, which have become harder to understand due to his stroke. The head OT, Dr. Campbell, brings Mr. Soto back to her room and she begins to ask routine questions such as, "What are you in for today? And can I get you anything?" Despite Dr. Campbell's calm demeanor, it is clear that Mr. Soto is very uncomfortable. When Dr. Campbell goes to begin the assessment of Mr. Soto, he begins yelling, "No, no, doctors, I will heal naturally." This causes Dr. Campbell to draw back, and she decides that she will do what she can to treat Mr. Soto without touching him and just get through this appointment. However, even if she just gets through this appointment with him, there are still many more to come, and without being able to touch him, there is not much she can do to help him get better. So, with this scenario, we would like for um, your role to be based off the first letter of your last name. So, for Hannah and I, we would both be Dr. Campbell. So, we'll just answer it based off of that. Um, so, Dr. Campbell's perspective is she wants to learn more about Japanese culture and design a treatment plan specific to Mr. Soto so that she can help him. And then the first discussion question says, based on the role you were given, what might be some benefits if the clinic chooses to implement your opinion? Basically, this would be probably the best case scenario for the patient because she would be adhering to like what he needs, what he wants, and she wouldn't be like ignoring his culture. She'd be acknowledging it, and ultimately, he would probably get the care that he needs. And then based on the role you were given, what might be some drawbacks if the clinic chooses to implement your opinion? The only one I can really think of is that, like, since this patient is so specific and takes a lot of time, it might like take up a lot of Dr. Campbell's time that she could be using to see other patients. But other than that, I really don't think that there would be any drawbacks if her opinion were to be chosen. And then discussion question number 3 says, regardless of your role, what opinion would pose the most benefits and why? Um, Obviously, Dr. Campbell would pose the most benefits because she's listening to the patient's concerns and she's adhering to a treatment plan that would be specific to him. And then to recap, we talked about our 4 key points, which were respect, equity and inclusivity, honesty and compassion, and transparency and communication. All these concepts are vital in creating an environment that is comfortable and feels safe to a patient. Without establishing these concepts, it can be hard to build a good relationship with your patient, especially those who come from different backgrounds from you. These skills can be important regarding establishing your personal relationship with friends, family, and significant others and keeping them. Therefore, these key concepts in your day to day life can be vital in building and keeping relationships as well as making ethical decisions when you are faced with dilemmas.